Parkinson's disease is a neurodegenerative disorder that is recognised as being a major leading movement disorder within Australia. Parkinson's disease is characterised by both motor and non-motor symptoms that arise as a result of the declining levels of dopamine in the corpus stratum of one's brain. As it is a progressive disease, the further it progresses, the more there is an increase in the severity of the symptoms. It is evident that no two people with Parkinson's disease will experience the same symptoms, and therefore the progression of Parkinson's symptoms will vary for each patient. Motor symptoms affect an individual's movement and are symptoms that are visible to other people. These include tremors, freezing, and dystonia. A tremor or shaking is one of the main symptoms of Parkinson's disease. A tremor is defined as uncontrollable movement affecting a body part. A Parkinson's tremor is caused by the limited amount of dopamine in one's brain. Therefore, without dopamine, movements are affected and cause a tremor. Freezing is when an individual is unable to move for a few seconds to a minute while walking. The cause of freezing in Parkinson's patients are unknown and puts older patients at a high risk of falls. Dystonia is a movement disorder caused by muscle contractions due to the incorrect brain signals being transmitted. Non-motor symptoms include dysphagia and chewing problems, hypotension, constipation, and Parkinson's dementia. Parkinson's disease can cause an individual to have trouble swallowing and can cause them to experience chewing difficulties due to a lack of muscular control or movement. People with Parkinson's disease also experience hypotension as a symptom of the disease or as an adverse reaction due to the medication prescribed to manage the symptoms. Reduced bowel motions can occur due to the slowness of movements and muscle rigidity of the large intestine and bowel muscles. A person who has Parkinson's dementia may experience forgetfulness and difficulty concentrating. Individuals may have difficulty in making plans or engaging in problem solving. Sleeping for long periods throughout the day and having a lack of motivation can be caused by Parkinson's dementia. Parkinson's disease is shown within evidence-based research to be effectively managed through behavioural changes. For example, implementing a good sleep hygiene routine each night to alleviate symptoms of insomnia and nocturia. This can include restricting fluids for a couple of hours and ensuring patients go to the bathroom prior to bed. Melatonin has been also proven to regulate sleeping patterns, assist with daytime sleepiness, and sleep fragmentation. A dose of 50 mg of melatonin 30 minutes prior to bedtime has been successful in increasing nighttime sleepiness and alleviating these non-motor symptoms in conjunction with good sleep hygiene. Cognitive behavioral therapy can encourage patients to work with their limitations rather than against them. It gives patients the power to discover new ways to participate in daily tasks, as well as exercise or take part in social activities that give them a sense of purpose and meaning. CBT can also teach patients relaxation techniques to take control of negative thoughts, encouraging them to focus on their ability rather than disability. By teaching patients with PD breathing techniques and meditation, they are able to feel in control of their symptoms of anxiety. Physiotherapy is only proven to provide short-term benefits. It can assist patients in managing their daily activities as well as maintaining their independence in mobilization. Tai Chi is an example of an extremely beneficial activity for patients and is evident to be effective in reducing falls among older patients. Deep brain stimulation is a surgical intervention used to manage the 4 cardinal motor symptoms of Parkinson's disease. As well as improving tremors, DBS is capable of alleviating some pain as a result of the disease, in particular musculoskeletal and dystonic pain. DBS is minimally invasive as well as reversible to alleviate any adverse effects as a result of the surgery. To maintain a healthy lifestyle and avoid nutritional concerns, patients should be educated on the importance of maintaining a nutritious diet when first diagnosed. A patient should be aiming for a minimum of 25 grams of dietary fiber per day to avoid constipation, as well as eating a diet consisting of vegetables and whole grain foods such as brown rice, which will encourage fiber intake. Patients may also be introduced to stool softeners such as Coloxal and Senna. in times where they're struggling with constipation, as well as ensuring that they are having approximately 2 liters of water a day to assist with digestion and maintaining bowel motion. Speech pathology is vital for patients with Parkinson's disease to help maintain aspects of communication, including speech and facial expressions. If a patient is referred to a speech pathologist early in their diagnosis, the speech pathologist is able to assess any difficulties that may arise in regards to communication and can provide strategies to assist with communication. There are currently no specific diagnostic tests for Parkinson's disease, yet neurologists will diagnose Parkinson's through a combination of tests and procedures, some of which include imaging, pharmacological testing, physical and neurological examination. In correlation with this, more specific testing can include a thorough review of a patient's medical history, signs and symptoms, pathology, urine analysis, Bunsen and creatinine, thyroid analysis, liver functions, serum, corneoplasm, copper levels, smell tests, and polysomnography. According to the Movement Disorder Society, Parkinson's disease follows two-step diagnosis criteria. Within the first step, Parkinsonism must be identified, which is completed through the established signs and symptoms of bradykinesia with fatiguing, coupled with additional symptoms such as rigidity. The second step encompasses 3 classes of diagnostic description supportive criteria, which includes deficits typical for Parkinson's disease that are seen in most but not all patients. The second criteria, absolute exclusions, means that deficits that reject diagnosis of Parkinson's disease are ruled out. The third criteria, which is known as red flags, involves deficits that argue against Parkinson's disease, however are not adequate to rule out Parkinson's disease completely.
Cinnamon has a combination of both levodopa and carbidopa. Levodopa is the precursor of dopamine that is prescribed due to its ability to cross the blood-brain barrier. The combination of levodopa with carbidopa inhibits the medication from being metabolized before it reaches the brain, due to it being a decarboxylase inhibitor. Most of it, however, gets metabolized and consumed in peripheral tissues by different enzymes, which significantly decreases the availability of levodopa. The combination of levodopa with enzyme blockers such as dopa decarboxylase inhibitors that considerably reduces the extracerebral consumption of levodopa and thus increasing its availability to the central nervous system. In regard to the recommended dose of cinnamon, patients are often prescribed 1 tablet 3 times a day. With contraindications, Parkinson's disease patients have a higher risk than others to the development of melanoma. Levodopa is evident to contribute to the stimulation of malignant melanoma, therefore patients with undiagnosed skin injuries or who have a history of melanoma should not use cinnamon. Precautions include, but are not limited to, patients being confused, agitated, the development and onset of depression, delusions, hallucinations and other mental changes. Adverse reactions include, but are also not limited to, nausea, vomiting, orthostatic hypotension, dyskinesia and motor spasms. Parkinsonism acts on the nervous system. It is indicated for the drug-induced extrapyramidal symptoms and pyramidal spasticity. Post-oral administration, imipramide presents its antidepressant activity following its passing through one's liver. The small intestine is a primary site of absorption, and the majority of the drug is well absorbed here. Imipramide is mainly metabolized by the liver and excreted 80% in the form of urine. The pharmacodynamics activity of imipramide hinders the neuronal uptake of noradrenaline and serotonin at nerve endings. The initial recommended dose starts at 25 mg to be taken 3 times a day. Contraindications include, but are not just limited to, patients with acute or recovery stages of myocardial infarction. Precautions include the continuous monitoring of suicidal behaviors or intentions, as well as the commencement of unusual changes in the patient's behavior. Patients and carers also need to be aware that the medication may cause feelings of disturbance, tensions, and anxiety. Adverse reactions include, but are not just limited to, drowsiness, urinary retention, hypotension, cardiac abnormalities, electrocardiogram abnormalities, restlessness, and disorientation. Due to Parkinson's disease having the ability to alter the chemical levels in one's brain, such as serotonin and norepinephrine, disrupting one's mood, it leads to the prescribing of antidepressants such as tofranil. After oral administration, there is 85% of bioavailability of the drug within the body. Half to 2 tablets 3 to 4 times a day, with the starting dose gradually increasing from half a tablet until the patient has reached the appropriate and optimal dose, is the recommended dose for patients. Patients with bowel blockages, megacolon, or have a enlarged prostate are also warned that their condition is contraindicated. Monitoring an abnormal behavior within the individual, which include confusion, impaired memory, hallucinations, irritability, tachycardia, as well as the increased convulsion tendencies, are precautions that need to be taken. Adverse reactions involve but are not limited to dry mouth, making it difficult for one to swallow or speak, developing a sensitivity to light, having difficulty urinating, becoming agitated, dizzy, and lightheaded when rising from being seated or lying down.